Hi, I'm Dr. Patty with Carolina Chiropractic. Today I am here with a patient who's going to tell us a little bit about what's going on with her, and then you're going to see me adjust her and do a couple of things with muscle work and everything else.
Sounds good. This is my 5th appointment. I initially came in because I was having a lot of pain in my hips and lower back. Now, I had to do a Google search because I didn't know if chiropractors actually worked with hips, but I figured since it's attached to the spine, you'd be able to help me. So that is initially why I came in. My mobility was really limited and I was just in pain all the time. I felt like a 60-year-old lady and I'm not 60, so
Not close.
I shouldn't be feeling that way. So that's why I made my initial appointment with you. And then it was an interesting diagnosis because he said I had hyper-tonic, which means really tight pelvic floor muscles. And I thought, hey, that's a good thing, right? To have tight pelvic floor muscles, but no, because they're muscles. They're supposed to be,
Supposed to contract and release.
Right.
Kind of thing, not just always pull.
Right.
Right.
So I had no idea. So the work getting to a place where I am now, feeling pretty good, it's been difficult, but it's been worthwhile.
Right.
Because I'm finally starting to feel like a 30-ish woman should feel.
Sometimes when you have those pelvic floor issues, certain things are uncomfortable, as well as like some of the movements and things that I do are uncomfortable. But like you said, it made you feel so much better afterwards, right? Yeah. Did you find any certain activities were difficult or any certain activities were easier?
Actually, all daily living activities were pretty difficult. They were painful. I think the hardest part was my relationship. Like it was getting in the way of my intimate relationship with my husband. Like I was just so tight. It was just uncomfortable. Everything was uncomfortable. Except for brushing my teeth.
Except for brushing. Doesn't really affect your pelvic floor that much. So, all right, so the first thing we're gonna do is we're gonna have you lie on your back with your head right up here. I appreciate you coming on our YouTube channel and doing this video with us. It is something a lot of people complain about, but not everyone necessarily I will say wants to talk about, and we treat a lot of women for this. We treat some men for some issues and whatnot. You can see how her legs, if you bring the camera over, are a little uneven when we start, right? How the knees don't go up at the same degree. And so what we want to do is we want to kind of stretch.
Take my shoes off.
Absolutely, please. So we're going to stretch her just a little bit. We're going to kind of stretch kind of the inner thigh here. And I'm sure you feel that a little bit, right? Mm-hmm. We're going to stretch across, kind of get piriformis and everything else. Nothing too crazy, just getting it loose. Now, one of the things that you felt really tender on was your adductors, right?
Yes, painful.
That was painful is probably a better word than tender. That is one of the more painful things that I do. The adductors and the jaw. The jaw is up there as well. So we're just kind of stretching a couple different stretches. Kind of loosen and warm her legs up before I do any muscle work. But this one, and that's all we're trying to do is get it to feel and move a little bit better. Now, if you have any questions or anything, feel free to comment below to ask us anything. If you have any questions or any statements you want to make, tell the audience, that's totally fine. We appreciate that because I don't like to tell people's histories. I like to let them tell their history. That way they're comfortable with what's being said. So we're going to move your knee to like a figure 4 position. But before I do, I just like to, after I test you, just kind of stretch a little bit more even, but still not great. We're going to bring this knee out. And we're going to work the adductors. The adductors pull the legs in. That's what adduction is. If you want to place your hand down, that's totally fine. If you want to cover, I don't want you to feel uncomfortable. We're going to come all up in here. And you feel how that's tender, and I can see your face kind of twinge a little bit, as well as your whole abs kind of tighten up and everything else.
Okay, right? I start sweating and everything.
That's totally normal. That's unfortunate, but it's totally normal. So we're going to do a little muscle work before we adjust her, because I find that works best. Sometimes, depending on the case, we might do the adjustment and then the muscle work, but she's at a point in which I can do the muscle work first. Because if I just adjust you, that's great, but at the same time, it's not going to hold long term. And so you're going to push this knee up and towards the ceiling. Hold it there for 5, 4, 3, 2, and 1. Relax. Good. We're going to do the other side. You ready?
Mm-hmm.
Bring this up. Good. And again, if you want to place your hand down there, that's totally fine. If you're comfortable with my hands, that's totally fine too. I like you guys to be comfortable. My silly joke, as I told you before, is always I like my hands in front of me where I can work, not cuffed behind me, kind of thing, right? So I like to make sure that my patients feel comfortable with everything that I'm doing. And try to explain what I'm doing. And
I
why
will
I'm
say that since I've been coming, this whole adductor thing has become increasingly easier and it's not as painful as the first time.
Oh yeah, the first time I could barely touch you.
Yeah.
The first time that I checked it, and you had no clue it was that sore, that tender, or anything.
No,
right?
I didn't.
And I gave you a home stretch too that we will demonstrate at the end of
Yes.
this that helped. I'm assuming.
I do
right?
it daily and it has been helping.
Good, good. All right. And so her knees are coming closer, if you can see that. I haven't adjusted her pelvis yet, but they're getting closer and better. Cross your arms, roll your feet towards me, breathe in and out. Go one more time, breathe in and out. Okay, you okay?
Yes.
So I do wear all kinds of crazy garb because of good old COVID-19. I like to wear the face mask and the thing. Maybe it's a little overkill, maybe it's not. Truth is, I'd rather be safe, not sorry, kind of thing. So, just relax. All right, ready? Good. And we'll tuck the top. We're gonna go right here on your low back, nice and easy. Good. And lie on your back. Not quite done with you, got a few more things to do. And if you look at those legs, much more even, not perfect, but much more even. Coming in. We're going to check the pelvis. Remember the 4 tender spots. Any of them tender? That one definitely is. That one's, which one was worse, 2 or 3?
They were significantly close, but I'd say 3 is probably a little bit more.
Okay. All right, so we're going to kind of come right here. And then we're going to come right. You okay?
Yeah.
And then, still tender, always is right now until we get it all loose and ready. Now you've had some kids,
3
correct?
children.
3 kids. I wasn't gonna say it if you didn't. I was just gonna say you had some kids, but and so that always messes with the pelvic floor as well as all these muscles and how the pelvis aligns and everything. But again, one more spot. I apologize because I know that's tender. Take both knees up and come check that out in comparison. A lot better, right? All right, you want me to adjust your neck with my hands today?
Sure.
Okay. I'll adjust your hips for a pull on your legs in a minute. I don't like to do that right before I adjust the neck because I feel like I touch your feet and then touch your neck. It's just a little odd. But just relax right here, nice and easy. Good. Relax right here, nice and easy. Good. How'd that feel?
Really good.
Keep her hips nice and loose and everything. Just trying to keep it nice and loose. Good. How's that okay?
Yes.
And then this one right here. Good. How'd that feel?
Very good.
Good. Stand up for me.
It's so much better.
Good.
Oh, I always feel so great coming on this.
You said basically bending or moving your hips at all was just painful. Like,
Yes, I couldn't even do this.
Not to be crude, but like even when you were with your husband, you couldn't. You had to keep your legs straight and everything.
Yeah,
right?
I did. I could not. It was sad. All right, so not only was sex painful, like I couldn't, there was no flexion in my hips whatsoever, but I would find myself running to the bathroom after I sneezed. And I had no idea that any of these things were in relation to my pelvic floor being too tight and I didn't know that that related to my lower back and hips at all. So ever since I've been coming here and doing the work, I've noticed a significant decrease of situations like that, having to run to the bathroom. Those have decreased, and sex has actually become something that's been more pleasurable and less painful. So thank you
We'll
guys.
do a quick stretch. If you don't mind demonstrating it
No,
for
I
us.
don't mind.
Okay, good. You've done it a few times, so I'm gonna stretch down. You can put your elbows on the inside. Yep. I'm gonna not try to fall over on the table hitting it. And exactly like that. So you want to kind of, if you can get your butt all the way to the heels, that's more preferred. I'll get out of your way, Christina. Because that gets a deep open stretch, that opens up the pelvic floor. And in the old days, the pelvic floor, they would tell you to do all these Kegel exercises because you had a baby and stretched them out and pulled muscle. And that was the old theory. And we kind of talked about this, and you started talking about reverse Kegels and everything else.
Yeah.
And my question to people is, if you've ever seen somebody pull a hamstring, do they have more or less mobility? And everyone always says they have less. They're like walking like this, you know, they can't really move it. And I would say, so would it make sense to tell someone to rehab that, to do isometrics, little small contractions? The truth is no, that makes no sense at all. What you want to do is you actually want to stretch that pulled muscle. And so that's where we talked about doing like reverse Kegels, as well as this stretch and a few other things, as well as the adductors and all that, just a simple little adductor stretch. And it made a world of difference.
It did. And it's just like Googling it was a huge eye-opening experience, because we are told, especially when it comes to women's health down there, I don't think we're really told to do a reverse Kegel when you do a Kegel. Like it's always, so that was actually a really eye-opening experience.
I always joke and say that a male came up with the idea of Kegels because they're like, oh, it just needs to be tighter down there, you know, kind of thing. No offense to anyone, but like, you know, like where did that come from? You know, what was their basis of that? Whereas when you think about it in the sense of being pulled muscles or strengthening it up, sure, but you also have to, you don't just do isometrics, you also have to stretch things too. So I'm not saying you can't do Kegels, but if you do them, you need to stretch them out as well. Okay? Any questions or comments, please like the video down below, comment. We'll be happy to answer anything that we can. Thank you.